The mission of the Outer Banks Hospital is to enhance the quality of life for the residents and visitors of Dare County and the surrounding region by promoting wellness and providing the highest quality health care services. Thank you for allowing us to care for you and to coach you toward wellness.
I'm Dr. Carolyn Day, and I'm a general surgeon with Vidant Health. It's very important for a woman to have a regular annual screening mammogram so that we can detect breast cancer early. Cancer is a progression. Cancer starts off localized. In this particular case, it would start off in the breast and spread. So theoretically, if you diagnose it early, you can prevent spread and treat spread earlier so that women have a better chance of recovering from their cancer. A lot of times a lady will have a finding on her screening mammogram that they get a call back for, and for a patient that's very alarming and they get very concerned. Most of the time they come back in and they get different magnification views and it turns out to be nothing. Occasionally there'll still be a finding there that needs a biopsy. In that case, even then, about 80% of the time, it's still nothing.
I have a yearly mammogram to make sure that it's negative. I have a family history of breast cancer, and so that peace of mind that it gives me every year is what I need. The technicians here at the Outer Banks Hospital make the process as comfortable and easy as possible.
Usually when I find a patient who has a new diagnosis of cancer, I ask them to bring their family in and we have a long detailed discussion about all of the treatment options available for breast cancer. Many of those treatment options can be done here locally, and we also offer the option of being referred somewhere else if a patient is more comfortable. Because of the geography here, it can be very overwhelming for a patient to seek care 3 or 4 hours away. Part of the way that we make sure patients get the care they need is through the Nurse Navigator program.
I believe a nurse navigator is important to a patient because a patient can be overwhelmed with the diagnosis. The whole family can be overwhelmed with the diagnosis. And there's only so much information that a patient and their family can understand in any of the doctor's appointments. I try to be at their appointments if the patient would like me to be there, and I can decipher with them after the appointment what the physician has said and review it.
I discovered that I had a lump on my breast probably around March, and then I came, for my mammogram. So I thought, what in the world is this going to be? Because I could feel that this was not a tiny little tumor. And then I was scheduled to meet Dr. Day, who was my surgeon, and then I had surgery on May 8th. And I was really very fortunate because I experienced no pain with my surgery. I was crazy over Dr. Day. She's very easy to talk to, and she's very matter of fact. So there's a lot of angels in this hospital, as far as I can see. I've had a great experience. I mean, just from going in the door to have someone say hello to you, why are you here, and then people who take all this information about your insurance and the whole, they were all extraordinary. So I have nothing but wonderful things to say about every single person that I've encountered in this hospital.
One of the great programs that we have at the Outer Banks Hospital is the Hands of Hope program, and it is a volunteer group. And part of that is the Look Good, Feel Better program. And that is when volunteers help with wigs and makeup and scarves and things for helping women feel good about themselves.
One of our goals of the Cancer Committee that we've been working on over the past year is to coordinate breast cancer care better and diagnostic care better. For a patient, that means that if they come in and they have a callback and require a biopsy, we're working very hard to make sure that that biopsy is done in a timely fashion.
We are trying to improve the quality of cancer care in general for this region. And one thing that we looked at as part of a programmatic goal in the last year was we tried to look at ways we could improve the efficiency of early detection. As you can imagine, the sooner you're able to prove that something that is abnormal is cancerous, the better the outcome. So we've worked on some measures over the last year to improve the efficiency of that process. Namely, we've done some things with Eastern radiology so that we have an earlier read on our mammograms. If there's something that is flagged as abnormal, we have a very efficient process whereby a nurse navigator is notified. And the process from that point begins sort of a time clock where the process is expedited.
We appreciate the logistics of living here and some of the limitations of geography, but that doesn't mean that we can't get timely diagnosis and care of breast cancer.
We really want the Outer Banks Hospital to be the place that you come for your breast health care.